This is one of the second health officials here that is in hospital. A nurse who works here who's getting her first jab. And as you can see, strong, feeling good. It's in your arm. How are you feeling?
I'm fine. It wasn't that bad.
The jab that brought much relief and hope for health workers in the province.
I think my message would be that they should go out there, and everybody is scared of the unknown, but they should go out there and at least have some protection against this virus.
After initial reluctance, health workers are now queuing for the vaccine, but the demand outstrips the supply. The Department of Health is opening more vaccine sites in rural areas, hoping to reach the 200,000 target.
At this point, we have in the main, the area that covers rural areas is in the Nelson Mandela Academic Hospital, where the Sir Henry Elliot Hospital has been opened to serve in the main as a mass vaccination site. And this also covers the drainage area of the Nelson Mandela Academic Hospital, which is largely rural. But when we go more inland, we also look at the areas like Zitulele, which is being considered. The researchers are looking at it at the moment. So both Zitulele and Madwaleni hospitals are going to be considered for the vaccination program.
Worker unions say the rollout of the vaccine in the Eastern Cape is too slow and the 200,000 target not realistic. More than 19,000 health workers have been vaccinated to date. Capacity issues are being addressed ahead of the wider rollout.
So the plans to expand and roll out are in place, but it's done in phases. So this is just the initial phase, what we are looking at currently. And the facilities that are currently vaccinating, there's 2 in Umtata, but we're looking at rolling it out to other facilities outside the area.
As we saw, the cubicles are quite small, and it can take just a small number of people, as opposed to the ideal situation if you look at the whole catchment area of this institution and the service that we need to give to the people in this aspect of vaccination. So you would have loved a bigger place and more numbers so that you are able to pick up speed and so on. But in terms of what is happening, even at this rate, it's satisfying. But we have to look at the challenge of actually expanding our services because we're dealing with the numbers here and quite a big number of people.
The initial rollout in Gqeberha encountered some problems. Outreach nurses from Dorangenza Hospital only recently got vaccinated after protesting at the offices of the health department.
We feel that we're being left out because we don't understand why were we not prioritized. You remember we were the ones that were in danger, even when it comes to robbery. But when it comes to roll out, we are not even considered. Had we not gone to protest, I don't think we could have been vaccinated.
The vaccine rollout also holds the promise of improving access to healthcare in rural communities.
I think while much of the planning to date is really just focused a lot on the vaccine site and the vaccinators, I think important to ensure that this is effective, particularly in rural and deep rural communities. There is a need to bring the community into the solution. I think at the moment we're really just looking at the community as subjects of the intervention rather than partners. What I would suggest the government, and particularly the Eastern Cape government, do now as we prepare for the mass rollout, is starting to trial some of these engagements in rural areas, like maybe by getting in touch with local community leaders, church pastors, traditional leadership, as well as traditional health practitioners, to work on the first phase of the vaccine, of mass vaccine rollouts. And for me, that is to start raising awareness.
The Eastern Cape currently has 8 vaccination sites, with another one set to be launched at Cecilia Makiwane Hospital in Mdantsane. Lerato Fekisi, SABC News, Gqeberha.